Good day, movement explorers. This is Fariya Doctor, your Feldenkrais Practitioner and movement detective. Today I'm going to be talking about proper tongue resting posture. I know that sounds a little weird, but there is a place where your tongue should be resting when you're not talking, or when you're swallowing, or when you're just at rest. It should be resting on the top of your mouth. Here is a model of the face, the side of the face, the sinuses, and the tongue. And if you can see, there's the palate, and there's the soft palate, there's the hard palate, so you'll feel it. If you just go ahead and bring your tongue up, like if you were to swallow, you should feel your tongue going up and pressing on the palate. It goes up and then back if you're swallowing. Now, this technique of resting your tongue on the roof of your mouth can be a little bit challenging for some people. So I'm going to show you a tongue exercise that you can do. This will help with overall nasal breathing. If you're struggling with nasal breathing during at rest, or you're struggling with staying with it during the night, or if you're finding during your workouts that you just can't maintain a nasal breath, this exercise will help. So I'm going to show you. It's a little weird, so I'm just giving you a little warning. It's called tongue caving, as I had mentioned before. It's pressing the tongue up onto the palate, and you'll see the tendon underneath. That's my tongue tendon. So this is what it looks like. And as you can see, there's a long tendon under my tongue. Some people find that they cannot do that. It takes a long time for their tongue to figure out how to suction up. And so it'll feel a little bit like a strain at the beginning because the tendon is tight. So take your time with it. Do it every day if you're finding it hard. I do it every day just to remind myself of that, where it should be lifting. And if you have problems under your chin, or you're losing your chin line, it can often be that the tongue is resting down all the time. So if you want a nice sharp chin line, keeping your tongue in that resting place on the roof of your mouth is a good thing. It helps support the face, it helps support the sinuses, and it also helps with your head posture. When your tongue is resting up, it provides a bit of a lift and at the cervical spine. So I'm going to show you again. You just swallow, suction your tongue upward, and as you can see, it's quite flat. I know it's a little weird, sorry, but I just wanted to show you that because it's so useful for nasal breathing. Like I said, it supports your sinuses, it supports your head posture. So if you're doing some lifting at the gym, bringing your tongue up, suctioning it on the roof of your mouth can sometimes help. It helps me when I'm lifting heavy. It creates a bit of a lift. It lengthens the back of the neck so that you feel almost like you're being pulled up. And it's very supportive also for the breathing airway. So give it a try. Can you try it right now for me? And as you're doing it, it can be really challenging if you're doing it for the first time, or if you've had a history of mouth breathing. Or if you talk a lot with your work, your tongue will draw up a lot and get used to kind of hanging low. And, as we age, sometimes the tone in the mouth gets a little bit weaker, or airways can narrow. That again will affect how you can breathe during exercise and how you breathe during the night. This tongue exercise can help support your goals for improving nasal breathing and also improving your overall health. The tongue is such an important muscle in the mouth. It's at the top of your digestive tract. So if your tongue isn't doing what it's supposed to do, it's getting a little lazy and floppy and hanging down too much, you're going to find yourself having more trouble with swallowing even. I have some clients who've had to learn how to do this so that they can swallow with greater ease. That's really important. You don't want to be choking, right? So the tongue is so important. It takes up a big amount of real estate in the mouth. So it is large and it's there. There are lots of different muscular attachments of the tongue, and it actually comes down and attaches to your hyoid bone. I know it's really complex, but it's very, very, very important muscle for breathing and for swallowing, and of course for talking, because you're wagging your tongue when you're talking. So give that a try and tell me, when you draw your tongue up to the roof of your mouth, what do you feel? Do you feel anything widening in your mouth? Do you feel anything getting a little bit more expansive, maybe at the back of your throat? This is really important too, to have lots of space back here, again, when you're swallowing, so that it is easy, and also a larger airway space. When the tongue is lifted, then you have more space here to breathe, because there's the trachea, there's the esophagus, there's the trachea. So when the tongue is lifted, your back of the airway opens a little bit more, and there's a little more space here for breathing. So give it a try, practice it. If you find it's easy, then bonus. Just keep doing it, keep practicing it, use it at the gym if you want to. And notice what you do when you swallow. And if you're struggling with it, just keep practicing. It gets easier when you practice. So thanks for tuning in. Leave me a note if you have any questions about this. I'm happy to help out. I also do a free consultation on Zoom and on the phone. So if you'd like to discuss this, if you're a new client and you have some questions, please reach out. I'm happy to help. Have an awesome day and enjoy playing with your tongue movements and tongue caving.